My name is Lisa Graves. I'm a family physician, and I've worked in a number of different contexts, both in Quebec, Ontario, both Northern Ontario as well as in Southern Ontario. I'm a 2012 AMS Phoenix Fellow, and the area of interest that I've been allowed to explore during my fellowship relates to the impact that technology has on our capacity to offer patient-centered care to the individuals that we look after. So thinking about how technology has changed the way that we practice, I'm a family physician, I practice clinical medicine. It really is about thinking about technology in a different way. Technology is often seen as a dividing presence, as something that gets in the way of the relationship that practitioners have with the individuals in their care. And so part of my work has been to actually explore what does the literature say about this, what is out there and what are others doing, to start to think about what are better practices in the use of the electronic health record, the electronic medical record, in providing care to patients, and to really start to think about how we might change aspects of curriculum that would force us to actually think in a more explicit way about how it is we're actually ensuring that the introduction of technology doesn't dehumanize care. The electronic medical record, the electronic health record, and technology in of itself need not be an impediment to actually our understanding of illness, disease, and what it is the individuals we care for require of us as a profession. But it does actually lead us to think about what we can do differently and how we need to actually be explicit in what we learn and how we think about technology. I saw an example once of a child who drew a picture of her family doctor focused on the computer and not focused on the family in the room. And that's just one of the striking examples of sometimes how the perception of care can change when we introduce technology, when we're not thoughtful about what happens. Technology allows us to be clearer with each other as a healthcare team. It allows us to communicate across significant distances, bringing care into places where care may not necessarily have originated. And it really allows us an opportunity to think about how we can do things differently. And when we start to actually frame that and change the paradigm from technology being something that we instinctively think of as dehumanizing care into something that equity-seeking populations might actually find enhancing care, if we can work within shifting that paradigm in the way that we educate ourselves and future medical learners, I think that that's going to have a huge impact on ensuring a future that provides more compassionate and humane care.